My final task today is to tell you a little bit about the placement guide that has been developed as one of the documents arising from this project. Look, the placement guide is an interesting document. The front end is really quite short. The front end just sort of picks up on some of the key points of learning that have occurred for the various project partners, the community managed organisations and the university settings and the students and so on and so forth. The bulk of the document is actually the appendices. The bulk of the document is a range of templates and policy and procedure pro formas and other supporting documents that have sort of fallen out of the literature and the pilot exercise as being required to support organisations, community sector organisations in undertaking this work into the future. And it's one outstanding example of how this project has led to capacity for supporting practice placements that will sustain beyond the life of the project. There are too many of these documents for me to describe all of them to you. I might just focus on a couple of those that you can see highlighted. One of these documents asks host organisations to do a self-assessment of their capacity to undertake placements. And, you know, not all organisations will be in that space developmentally or in terms of their strategic priorities or in terms of the kind of work that they undertake. Another example is this placement guide. The community sector survey told us that organisations wanted a template for saying, well, what is it that we do? What is it the universities do? What's the responsibility of the student in this mix? So we did look to the New South Wales Health Student Placement Agreement and also the recently made public Health Workforce Australia guidelines for practice placements, and from that came up with an agreement template that's well suited to work in our sector. Another example is this sheet, Tips for Students. And these are the main headings that appear in this supporting document, and it basically encourages students to think about how they're going to get the most out of their practice placement and be assertive in ensuring that the placement's addressing their professional development needs. And this actually links to another personal favourite of mine, which is a pro forma for interviewing potential students around practice placements that gets them to think about recovery orientation and preventative and community-based mental health practice approaches before they even get accepted for a placement. So here are some examples of some of the documents in the placement guide that people may find helpful. So, yeah, look, thank you for attending today's webcast. If you want to find out more information about the project and access the documents and share this webcast with others, you can find it at the MHCC website. Here's information about how to get to us. I briefly want to acknowledge the cast of thousands that was involved in our reference group. It was an absolute pleasure to work with all of these people, and I'm really just very confident that relationships between the higher education providers and the community managed organisations will continue through hopefully both organic and more strategic approaches, both working into the future. And finally, just to acknowledge the project funders and administrators and consultants that contributed to this ambitious body of work. Without this without you, none of this would have been possible. So thank you very much to the panel again for being here today. Thank you to our audience, and thank you to those of you that are viewing in over your computer. Please contact us if you want to know more about the project, or if you're doing a community sector or mental health project that you'd like to tell us about, so we can continue to learn. Thank you.